It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, St. Vincent recently opened a Castleton neighborhood hospital in Indianapolis, one of several neighborhood hospitals it is launching around the state. But that is just one of the many things happening at the state's second largest healthcare system. Barbara Lewis sits down with the St. Vincent, Indiana CEO in the Business of Health. Barbara?
We only have a few minutes, but we need about an hour or so.
Right.
Well, the new facility is part of the new way healthcare is being delivered. And joining me to talk about programs and future plans is the CEO of St. Vincent, Indiana, Jonathan Nally. Good to have you on the program.
Barbara, thanks so much for having us.
So, micro-hospitals, neighborhood hospitals really have their detractors. Why are they such an important part of your strategy?
Well, as you've seen, healthcare continues to evolve. It's transforming at a rapid rate than never before seen. Increasing pharmaceutical costs, how care is being delivered, the education of consumers and patients about wanting to drive more of that. We feel that if we don't drive transformation in healthcare, we will be disrupted, and so we believe disrupting ourselves is the most important way to evolve healthcare as an industry.
Okay, a quick question before we launch right back. Everyone's talking about 96th and Spring Mill, the land that's sitting there. What's the latest on that?
Absolutely, it's a great question. The land acquisition at 96th and Spring Mill plays into an overall strategy of how do we position ourselves in the future. St. Vincent just moved our corporate offices to the Parkwood West building at 96th and Spring Mill, saw the vacant acreage next to us and felt it was in our best interest to secure it in the event we wanted to do something in the future. We still have no plans for that property, but we feel in the best interest of the organization and how healthcare evolves, we would want to have that contiguous to our new corporate office.
Okay, so how does that, and let's briefly talk about this overall strategy that you have for the entire state and how you're kind of staying one step ahead of what you need to succeed in the healthcare industry.
We refer to it as reimagining healthcare. How do individuals, patients, consumers want their health care delivered, and what is the expectation they place on anybody that's delivering health care? For St. Vincent, we've taken the approach of one hospital, multiple locations, which really refers to every one of our inpatient, outpatient, on-demand virtual care centers throughout the state of Indiana to ensure that we're connected with our patients, holding their hand, prenatal to end of life and every step along the way. And how do we need to evolve that so we are more patient-centered in the future? Okay,
so when do we go to the neighborhood micro-hospital and when do we head to one of the bigger facilities?
Absolutely. The vast majority of patients that are seen in one of our existing facilities with an ER, as well as any other hospital, can be seen at a neighborhood hospital. We see them quicker. We see them with the same ER physicians, the same inpatient medicine physicians, the same protocols, medical record, connection, you name it. It's just in a facility that is closer to their home. It is quicker service, provides the same outcomes, and we believe over time will show it is a lower cost to patients, employers, and insurance companies.
All right, well, Jonathan Nally, we have a lot more to talk about, but no time to do it, and so we'll have to have you back. Thank you so much for being on our program this week.
Thanks so much, Barbara.